A federal appeals court is preserving partial access to a widely used abortion pill. The future of the drug, mifepristone, has been up in the air following a ruling by a Texas judge that blocked its FDA approval. But an appeals court in New Orleans decided the abortion pill is legal with stricter rules. They will only allow the drug to be dispensed until 7 weeks of pregnancy. The pill it cannot be sent by mail.
There are several other big health stories today, including the U.S. speeding up development of new COVID vaccines, treatment for those with long COVID, and a drug to help fight sexually transmitted infections. Joining us now to talk about it all is Dr. Bill Hartman, principal investigator for the UW Health pediatric Moderna COVID-19 vaccine trial. Let's start, though, with the money. And a lot of it is being spent on the development of COVID vaccines still. Is this for new variants of it or different types kind of moving away from the mRNA vaccine technology?
So a little bit of both. The government has promised $5 billion to be infused into this. They call it Project Next Gen, where they want to develop variant-proof vaccines. So using an epitope different from the spike protein to go after COVID, but also to create nasal vaccines of this type so that we can start to prevent infections in the first place. And so these nasal variant-proof vaccines are what's on the horizon using this $5 billion.
$5 billion. See, we told you it was a lot of money. Well, long COVID sufferers, especially people who have had their smell affected by COVID, may now have a treatment option for this. What do we know about this at this point?
Right, so this is coming out of Cleveland Clinic right now, and what they're doing are these stellate ganglion blocks for the 15% or so of people who still have lost their sense of smell and sense of taste. No one really knows how these blocks are working. It's a sympathetic nerve block that happens on each side of your voice box, and about 50% of the people that have been treated in this way have had a return of their taste and smell. It's not a sympathetic nerve process, so we don't exactly know how it's working, and it's led to some skepticism. But anecdotally, people will tell you that this technique is working and helping improve their lives again.
And I'm sure that you don't even realize how much you rely on your taste and your smell until you don't have it anymore, right?
Right. It's no way to live.
Well, switching gears a little bit, let's talk about STDs for a moment, because there is some promising and then not so promising news about them. The not so promising news is that STDs are on the rise, but there could be a new drug to treat some of them, right?
Right. So STDs are definitely on the rise, and in the United States alone, we're seeing syphilis levels that we haven't seen since 1950. So it's a dramatic increase in the number of STDs for a variety of reasons. But good news is that a very popular and very cheap antibiotic known as doxycycline is being studied as prophylaxis. So for people who've had unprotected sex, they want to make sure that they don't get one of these STDs. They can take one of these pills within 72 hours of their unprotected sex, and about 90%, somewhere between 60 and 90% of them have been able to avoid developing the STD.
That is really interesting. All right, we'll keep following all of this. We always appreciate your insight, and I know we covered a couple of different topics today. So thank you for that, Dr. Hartman.
Great, thank you.